Hi, I'm Kelli Rumpza, and I'm the Watertown Healthy Youth Coordinator, and today I have 3 guests with me, and we're going to be talking about mental health. May is a time to raise awareness of those living with mental or behavioral health conditions and to help reduce the stigma so many experience. So today I'd like to introduce our guests, and I'll start with Kari.
Hi, I'm Kari Johnston, the Executive Director of the Human Service Agency.
I'm Alexis Buysse. I'm the Mental Health Officer for the Watertown Police Department.
And I'm Angela Hyde, and I'm representing NAMI, South Dakota.
All right, thank you. To start off our conversation, I'm just going to ask a general question to you guys, and anyone can add or provide input, but just to share and to let the audience know about this topic. So tell me, what's the difference between mental health and mental health conditions?
Angela, I'll let you take that one. We were just
I was
talking
just
about
going to
that earlier.
say, Kari, take
Yeah,
it.
you go right ahead.
Well, I think, first of all, I think there's a lot of confusion between mental health and mental health conditions or mental illness. Those words get interchanged a lot. And I think it's important we distinguish between those two because everyone has mental health, just like everyone has physical health. And just because you have mental health condition, you could still be mentally healthy. So there's a distinction there. Someone has a mental health condition, that's a medical problem. Just like heart disease or diabetes, it's a chronic condition. So I could have heart disease or diabetes and still be physically healthy. Just like I could have a mental health condition and still be mentally healthy. They're two separate things. What do you want to add to that, Kari?
I'll speak from a clinical perspective too, that like Angela suggested, we have mental health and we all have that to a degree, right? Some days we have bad days, we have good days, but we all have mental health that we want to care for and look after. Mental health conditions is maybe something that's more diagnostic in nature. A person comes through our doors because they're experiencing some distress in one area or another, and we likely have a diagnosis that will help them. And we can get them back on their feet, feeling better, so they get back to the mental health part of it, even after a few sessions. Mental illness, by our definition, is individuals who have mental illness that's a little bit more chronic potentially. They can definitely live a life of wellness, but they might need to maintain that psychotropic medication, some case management, some therapy for years on end, because they just their diagnosis is of such that it causes them some impairment in one form of their life or others, and they just need some help from other people.
Okay. Anything else anybody would like to add to that? So when we talk about mental health and mental health conditions, we know that there's a lot of stigma tied with it or misperceptions or conceptions about that. If you were having a conversation with someone, we know like when we talk with youth, there's some hesitancy about it, and there's a lot of slang words that we hear from people. And so we're really trying, not to use the word crazy or not to use different words like that because we need to be considerate of that. But talking with people, how do you get people comfortable in talking about mental health conditions and kind of helping with that, reducing that stigma?
Well, it goes back to what your first question, quite honestly, is that we are all in a continuum of care, right? So there's mental health, and there's maybe a moment where we have a mental health condition, and then we might have someone who we know has a mental illness. All of it is misunderstood, I think, by a lot of lay people, in that we all are somewhere on that continuum, and that mental health services are there to help anyone when they maybe move to one piece of the spectrum or slide them back and forth, and that we seeking help or seeking medication or any of those things are all just part of being healthier, and that they shouldn't have a stigma attached in the same way that going to the doctor shouldn't have a stigma attached for whatever condition a person might seek help for from a medical provider. So we just try to educate everyone. I think the stigma is really always tied into a lack of awareness and education, and probably too much belief in what Hollywood produces these conditions to be of such, like, demonstrated in a way that lends itself to the crazy or nuts or those kinds of words that we hear people disrespectfully use.
I think just talking about it really helps too. Just getting it out in the open and talking about it helps normalize those conversations around mental health, saying, hey, yeah, are you going to the, I'm not feeling well, I'm going to the counselor today.
Mhm.
Or, I'm struggling right now, I need to make an appointment with my counselor. Just being open and honest about it is a good way to normalize those conversations
Mhm.
around mental health, and being comfortable talking about it really helps too. And words really do matter. What you say really does matter, and it can really hurt people, because if you're living with a mental health condition like schizophrenia or bipolar, and to have people say, oh, you're crazy, or you're nuts, or you're a psycho, to hear that over and over again, that really does hurt.
It does.
And that, that makes a difference. So, trying to say things instead of saying, it's really crazy or it's really chaotic. Just making those changes like that can really make a difference in reducing that stigma. So trying just to be aware of your language really can make a difference too.
And that's a good point. What are those different words that we can be saying? Because I catch myself even saying, oh, it's just been
nuts
or
Yeah.
just crazy, and I really am trying to be more aware and sensitive to that. So I like the chaotic. Is there other words or things that you guys use to help people kind of, what could be some other words that they could say, or what could they be doing?
Not that I would encourage anyone to talk about someone that,
Right.
in terms of them having their diagnosis, but we've often tried to say, instead of he's a schizophrenic, he is a person living with schizophrenia, if we even need to go into that kind of definition, but just to help them understand that it's not a label and that it's a condition that which they're dealing with, because we don't, like you would say a person has diabetes, I mean, those kinds of examples I think can lend themselves to how we should speak with people with mental illness or mental health.
Right. You don't say someone is cancer.
Right.
Right.
Like, a lot of people say, well, she is schizophrenic, or she is bipolar. So they have that.
And they're
It's
looking
just
with
part of
that.
who they are. It's not
Right.
all of who somebody is.
Right. So kind of segue a little bit and ask Alexis here. So we're talking about maybe some conditions or behaviors that we're seeing. Maybe what are we seeing in our community right here in Watertown? And maybe Alexis, kind of talk a little bit about your position and role in the community.
So I guess I see a lot of different things. I just started this position in January, so I would say even just since January, my eyes have opened a lot. Just, the regular everyday person maybe doesn't see what, the police officer side of it, but then I also am now incorporating the mental health side of it. So it's kind of a dual. I do get a lot of pushback, I would say, or I did right away, of, oh, you're a police officer, like you're not here to help me, you're here to arrest me. You just think I'm crazy, you want me to go to, Serenity Hills or Rivera or something like that. You're just here to take me. And getting past that of, no, I'm here to help, like I'm here to connect you with resources, I'm here to, listen. If, maybe it was just you're having one bad day, maybe this is, ongoing of many bad days, let's figure it out so we can best help you. That's what I'm here for.
Right. And so for your role in the community as the mental health officer, then is it like if a call comes into the PD or something like that, then you're called to go to that home, or is there like follow-up, or how do you come in contact with different community members?
So it's a little of both. If I work, I guess, regular hours now instead of the rotating shifts like I used to. So if I'm working, if I'm there, I will respond to that call if I'm available. If not, then I will do follow-up with the person the next day or a couple days after, just depending on the call, and maybe they need a day, they're in the hospital or something like that, where they maybe need a day in between, so they can get some rest and stuff like that. And then I'll go and follow up with them, see if they do have any services that they're already partaking in. If not, what services do you think you could potentially need or would want, and I can try and get them connected with those services.
Alexis also has worked with our staff at the Human Service Agency, so hopefully I've learned a lot more about what we can provide, and participates in some of our staff meetings at times just to update us on individuals that she's worked with that she's handing off, so it's more of a warm handoff to our staff too. So
That's
it's
nice.
a great resource.
Mm-hmm. It's nice to show that partnership too, I think, in
Yeah.
the community, to
Yeah.
show law enforcement and mental health agency working together, trying to
Mhm.
assist.
Mhm.
Because I think that's also kind of a stigma that we see too, that it's negative, that it's criminal. different things like that. And I know that we're really trying to help people to understand that it's a behavior or it's a disorder, and we're trying to get them the resources and connected to those that can help.
Kelly, I think a lot of times people don't realize how common mental health conditions are.
Mhm.
You know, 1 in 5 people have a diagnosed mental health condition. We just learned that 2 out of 5 people have displayed symptoms of depression and anxiety over this past year, which shouldn't be surprising,
Right.
to people. I mean,
Right.
NAMI's national helpline had a 90% increase in
Oh, wow.
calls and emails over this last year, so that's pretty telling that, you know, people are really struggling right now, and I think we're gonna keep seeing the fallout from last year trickle down.
Mhm.
So, you know, it's really common for people to be struggling and having problems, and it's very important that we take care of ourselves and our brains
Mhm.
and each other and reach out for help when we need help, so we can kind of get help before it reaches a crisis point
Right.
and somebody like Alexis needs to be called. So that's very important that we do that. And realize that it is so common, so there's, you know, there really shouldn't be that stigma around
Mhm.
it, because everyone knows somebody. I guarantee that everyone knows somebody
Mhm.
that has a mental health condition.
I agree. And Angela, you mentioned NAMI, and for us, we know what NAMI is, but maybe just explain a little bit, what is NAMI, what does it stand for, and what's their role?
Sure. NAMI stands for the National Alliance on Mental Illness. We're a volunteer grassroots organization, the largest in the country. We do education, advocacy, support for people living with mental health conditions, and caregivers supporting those living with mental health conditions. So we provide support groups for people with mental health conditions and support groups for caregivers of people with mental health conditions. We provide education, awesome education classes for people, and they're all free.
Mhm.
It's all free to participants. We provide presentations, educational presentations to whomever wants it. We'll come and talk. I say we talk to anyone, even if you don't want to listen. We'll talk.
Right.
We'll just keep talking until you maybe listen. Just education, basic education about mental health. You know, what is mental health,
Mhm.
mental health conditions, how to get help. And then we provide that advocacy piece too for the more systematic things, you know, with the legislature, to make sure that, you know, looking out for people with mental health conditions. We're really concentrating on wellness this year too. You know, that piece of it's very
Mhm.
important that we take care of our brains, take care of our bodies, get the help, places like HSA when you need the help. You know, what I really like about the community health centers that I think a lot of people don't realize is that they make it accessible for anyone. You know, you don't have to worry about money, you don't have to worry about that piece of it. They really take that away
Mhm.
as a barrier for people, so they can go to HSA and get help. Doesn't matter about your insurance, it doesn't matter about your copay, it doesn't matter about any of that. If you want that help, they'll make it happen so you can get that help.
You want to add anything more with that, Kari?
Thank you. Thank you. That was very nice. I would also add that in addition to what Angela was saying about finances shouldn't be a burden, we find ways to make it work for everybody. We also strive to provide very confidential services for everyone. So while we don't want there to be a stigma, we also very much respect that some people feel apprehensive about coming in, or they are just a little bit unsure. So I make sure that we can provide services in the evenings or at a place or a location potentially that's comfortable for that individual, because we want to make sure everybody's just feeling comfortable with the help they're getting. So whatever we can do to make it better for them.
You kind of segue into my next
Oh,
thought
there you
here
go.
with counseling, because we know that there's a lot of stigma with counseling as well. And so I think it's good for people to hear maybe what to expect when they're going into a counseling session, or now that I've seen a counselor, do I have to go to a counselor forever and always?
Sure.
You know, just kind of, what can people expect?
Okay. Well, anytime an individual comes in, we have two different types of counselors, right? At Human Service Agency, drug and alcohol counselors, and then mental health counselors. The format is basically the same, where an individual will fill out some paperwork before they come in, indicating what they're there, the reason to be seen. And then when they come into the office, the counselor will just go through certain domains of questions to try to help the individual assess and focus on what they're talking about. And sometimes people can come in and just say, I'm not sleeping, I'm not eating, I can't figure this out, my doctor referred me. And then we get to talking and we can identify there's a lot of areas of stress that are contributing to your inability to sleep, your inability to eat, and so we address coping skills and what would be helpful in those to better the person's life and get them to their goal. So we also ask them to establish what their goal might be, and that is up to the client, that is never up to the provider. What can we do to get you to feel your life is fulfilling and you're not having distress? So once they can identify that goal, we are there to help them get to that goal. So an individual might come in, that first session is always an hour for the mental health therapist, and with drug and alcohol it might be a little bit longer because they talk about all the substances in their life. And then they come back for mental health. They can come back once a week, every other week. It really is individually based. I can't even tell you cookie cutter what it might be, but some people might come in 1, 2, 3 times. Other individuals might come in every week for 6 months. It really depends upon where they feel like their goal is and when they feel ready to discontinue counseling. But again, all at the client's pace. So whatever they want, we're there to meet them halfway.
It's nothing like you see on TV where you go into a counselor and you tell me all your problems, unless that's what you need.
Right.
It's more like teaching coping skills and giving people tools to help deal with what's happening. And you don't have to wait till you are in crisis to go to a counselor either. You know, like if you're facing a major life change, great opportunity to go talk it through with a neutral third party of, I don't understand how to do this, or, anything like that. You can go and talk to a counselor. Right about things.
You make a good point. It's not like Hollywood does us such a disservice, to be honest.
Yeah.
There's no couch, there's no laying down. It's just a comfortable setting, much like what we have today, where we just have a nice conversation. Now, the clinicians that you're working with have a master's degree. Many of them are licensed, so they are very familiar with just the development of life and what coping skills or interventions and therapy skills that we might need to help that person get to attain their goal. So some people might minimize and think it's just talking to somebody. It's a lot more than that, but it's also that comfortable, if that makes sense. So I want people to know that it is as comfortable as just talking to somebody. On the other hand, you're getting a professional, experienced clinician who can help you get to reach your goal and help your life feel fulfilled, and so you're not stressed.
I know myself personally speaking, I've gone to a counselor on and off throughout my life, and I found it really helpful that like when I kind of get stuck in something and just like I just can't seem to get past this, going and talking to somebody and then have them just kind of reflect back to me in a different way. Having somebody else say, oh, well, have you thought about it in this way? It's like, oh, geez, okay, that really helps. And just that alone is just so incredibly helpful. And then that whole piece of, teaching tools, teaching me different coping skills and how to handle things differently, because I wasn't born knowing how to handle stuff. You aren't. No, you aren't born knowing that. You learn it, and sometimes you don't learn very functional coping skills, or you figure out coping skills on your own that aren't real functional.
That are not functional
or healthy.
Or healthy.
Yeah. I also feel like I learned that people don't communicate very well, so they can come in, right?
Yeah.
Like,
really?
I know. I've been accused of over communicating at times. I know.
Me too.
So I think that means that's nice for shut up, but I'm still. But some people might come in and they're having, like you're saying, like a day-to-day issue, just a life struggle that they are feeling very distressed about, and just having a third party that's not emotionally invested help them reframe that differently or teach them how to communicate it better in a way that's maybe more efficient in expressing their feelings can really do some good justice for people. It really can be that simple too. So
like at work or something, if you're like, I just can't seem to communicate with my boss or my coworkers. I'm just struggling and having a hard time. Talking to somebody about that, they can just reframe it, and it's like, oh, why didn't I think of that?
So looking at reframing things, law enforcement is looking at more of that prevention, early intervention component with mental health officer. Can you tell us a little bit why the police department chose to have this role and kind of what the expectations and hopes are of this role?
So, with COVID, obviously there's good and bad that came out of that. Part of the bad is we did see an increase in the mental health calls for service that we were receiving. But the good that came out of that is we applied for a grant that allowed us to get an officer to do that. So I'm on a grant right now, but I'm assuming that we'll keep on with it. It's something that's becoming very important,
Mm-hmm.
not only here, but everywhere in the world. And just having that partnership with everybody in the community of different resources and everything like that, to just, there's a lot of people who don't know where to go, or don't know where to turn, and maybe they're not to the crisis point yet, but let's not get there. Let's, if we're seeing maybe some issues in just a regular, police call for service, the officers will refer that to me. They'll be like, hey, maybe you should just go talk to them, see if they need anything. And then I'll go out and talk to them, see, maybe there's some of those things, the day-to-day stuff, or maybe it's more than that. And I can kind of, I'm not a professional by any means, but I can kind of see some of that maybe starting, and we'll refer them to, HSA, or that warm handoff and stuff like that, where I'm like, hey, this person, this is what they're experiencing. Are they already doing services with you, or could they potentially benefit from services with you? And then, I'll keep working with them if that's what they choose. If they don't want any help from me, then I will leave them alone. Some people, it takes, a little bit, like I said earlier, just, why are you asking me these questions?
Right.
Are you gonna take me somewhere?
Right,
that
they're a
kind of
little
stuff.
hesitant and.
Yeah, so just trying to put out there that, I'm not there to take you away, I'm there to help, and I wanna do, the best to fulfill your life, like Kari was talking about. We wanna make sure that everybody's living a good life. We don't want you to have to struggle. We definitely don't want you to have to struggle alone.
Absolutely.
I think you kind of brought up another important point, that if somebody wants help, we can't force people to get help, and it's not against the law to have a mental health condition or be mentally ill. So I think that's important for people to understand too, that, it can be incredibly frustrating and incredibly heartbreaking to have somebody that is struggling and be ill and not take the help and not get the help. And all we can do is just keep offering that help and keep trying to keep them safe. But that can be hard, and that can look like, from the outside looking in, that nobody's helping this person, and why aren't you helping this person? But we have to respect their right to not get help, because the only way we can force that help is if they're a danger to themselves or others. That immediate danger
And I
to
was just saying,
themselves
even that's
or
temporary at
others.
times.
Yeah.
I'm glad you mentioned that. I try to bring that up. Kelli, you all three have heard me lecture a little bit, that people do have rights, and it is within their right to have a mental illness and be unmedicated. And if it makes other people uncomfortable, I'm sorry about that, but that doesn't make them a danger by any stretch of the imagination. I see it with all people of disabilities, that other people in the community, not Watertown community, but in any community in society, are uncomfortable with someone with disability. And they might call another person, whether it's Alexis, myself, to say, they're crazy, they're whatever. They're not doing anything wrong. They're not posing imminent danger to self or others. They get to do that. And what we need to teach our kids and everyone else is to be empathetic to that, and to be understanding of that, and to not be judgmental. And if they feel there's a danger, then they certainly should call someone. But 9 out of 10 times, it's just this discomfort that they might have with that individual. Now, some people that call because they see an individual they think needs help, and maybe they do, but if the person doesn't want the help, they just have to respect that. And that is actually where I love NAMI, that I refer family members for individuals who have mental illness. And they're so frustrated, and I understand that, because their person who has mental illness maybe doesn't want to take medication or get help they need. They don't know what to do. I refer them always to NAMI, because it's such a nice support that they have for other parents and other family members of people who have mental illness, and they can just, they're walking the walk too, and it's very helpful for them too. So that's just my shtick, but I always give them.
Right, well, that was one of the
respect
things,
people, but yeah.
was to bring up what are some of those challenges we see, and I think you guys have addressed that in our community and at a national level as well. But getting back to locally, we've talked about NAMI. Do we have NAMI right here in Watertown?
We do. Nick and Diane Krantz are wonderful volunteers. Wonderful. They help run when we can do it in person, and we will get back to it again. They have local support groups. Right now we're doing all of our support groups via Zoom, and we'll continue that even after we can do things in person, because I think it just makes it more accessible to people. You can just log on from anywhere. And we have found from all over the state, we even have people from other states log into our support groups. We'll continue that. So our support groups are all online now. And you can go to namisouthDakota.org to find those resources. Our family-to-family support groups online, our connection support groups online. All of our classes are online too. So that's very helpful.
So broad range of resources
And we also
services.
do a lot of wellness activities, just fun things to do. And you don't have to have a mental health condition to do those things. They're just fun things to take care of yourself.
Right.
You know, we need to have fun. We need to take care of ourselves, blow off steam. Like tonight, we're having Joan Zeke, she's an artist in Sioux Falls. She's doing a thing on Zoom on how everyone can be an artist and how that's good for your mental health to express yourself. And it's totally free. I mean, you just log on to Zoom and she takes you through on how to be an artist. And if she can make me an artist, she can make anyone an artist. I mean, really, come on. So, you know, all of those things. We have something going on every single day this week because our walk is at the end of this week on Saturday, the 22nd. So this is our kind of our wellness week.
Right.
So
And I
there's
think-
always fun things going on.
Yes, and you know, kind of getting back to May and Mental Health Awareness Month, there's just a lot of different opportunities. And I like that people are like, oh, awareness months, they're fluffy, what are they trying to do along with education? But I think it gives people an opportunity and an excuse to try out some different resources and services too. And so, just trying to encourage people, like you said, you don't have to be in crisis, or you don't have to have a mental health condition right now, but just take that opportunity, because I think everybody needs that opportunity to learn. I think some catchphrase words or keywords that we've been hearing a lot about, but I don't know if people truly know what that means. One is self-care. We talk about self-care a lot, but what does that truly mean? And also empathy. We make the assumption that people truly understand what empathy is, but I just think if you guys could take a few minutes here just to kind of share either one or the other, or just explain it a little bit more on those two areas.
I'll take empathy. It's anybody who has it, give it to me. And it is kind of a hard definition because people quickly get it mixed up with sympathy.
Right.
Brene Brown does this excellent little cartoon, if anyone wants to YouTube it, on what empathy is. But it's basically joining with somebody who's in a struggle, right? So I might not know what it's like to lose a spouse, but I will sit with that person and I can just feel for them in that they are struggling with grief, loss, parenting, all the things that go with that change of life. And with no judgment. I think that's the biggest piece with empathy. If judgment comes in at all, it really negates any of the empathetic value that you might have had to offer prior to that. Sympathy basically is thinking like, well, that kind of stinks for you, poor you, and let me know if I can help you, and then kind of walk away from it. Empathy is joining with you, sitting with you through whatever you have, not judging, and just having an open, unconditional heart to that individual. You might not know what it's like yourself, but you can only feel and experience their pain by watching what they're going through.
And you don't have to fix it for them.
And you do not have to fix it. No, empathy works best when you maybe don't have those absolute tools to fix. It's more just sitting here with you and understanding that this must not be very pleasant for you to go through. So, and understanding that. So I can't say it enough that not being judgmental is really the key thing that we need to offer to other people. So,
Or those at least statements.
right,
You know,
yeah.
well, at least you're not this, or at least your other kid is okay.
The
or-
toxic positivity that we sometimes offer,
Yeah.
right? I think, and to say, I always use the analogy that when you're hungry, does it make you feel any less hungry to know there are people starving around the world? It does not. It's still hunger that means that to you. So I'm going to sit with you and help you figure out what we can and understand that that's painful for you, even though your life could be worse by people's standards. It is hard for you right now, and that's what we're here to do. So
It's okay just to say, man, that
Yeah.
sucks.
yeah.
I'm sorry.
Yeah.
A lot of times, especially in the police world, we run into people on their worst day. I mean, it's their worst day. The police are there. It's generally not a good situation for the most part. I've been thanked so many times for just sitting there and listening to somebody. Just, even if it is, we're talking about something that maybe it didn't even happen today, but just something to get out, get it off their shoulders, get it out, have somebody actually care and actually listen to them, that they can just relieve some of that stress. And I think that that's a big part of, empathy too, is just
Mhm.
letting them get out, their story or whatever's going on, and just not interrupting them and just letting them express themselves.
That's interesting. We do a lot of presentation to kids in high schools, and we always ask the teenagers, what do you want people to know about mental health and how we can help you become healthier mentally? And the consistent thing they always say is, we just want people to hear us.
Mhm.
We just want people, adults, to listen to us and to believe us.
Mhm.
And that's that empathy piece.
Yeah.
Not say this is just a phase, or
Right.
you'll get over it, or it could be worse. Just listen to us and hear us.
I think that's a very good point, at any age too.
Yeah.
And I think you guys brought up another good point, that you don't have to have the answers and you don't have to fix it. They just want someone present.
Mhm.
And I think that is so key too.
Mhm.
Just a lot of good things.
Self-care, we never talked
Yeah,
about.
oh yeah, so
I was trying to
see, we
remember
always
what
skip
else.
over
We're all
self-care.
super
We always-
empathetic,
whoop.
yeah.
I think we all need some self-care
Right.
for our memories.
I think self-care, and how I would define it, I mean, that's also up to each individual too, right? Because some people are driven by motor, and that their self-care is making sure they stay busy. Other people definitely need to take time for themselves. I would say to take a look at how you're feeling, and then address it like you would somebody else. So if you're feeling too stressed out because you have too many events planned, then take time out and just don't do one of those things, and stay home. Say no. Learn to say no. Learn to identify what your pressure release is. And like some people, it's getting a massage, reading a book, exercising, working out. Some of those standard ones. Any of those that you feel you identify with that just helps you feel better, and then make a plan for it. That's
And
my
don't feel
self-care.
guilty about it.
Right. Yeah, I'm guilty of that one.
Yeah.
I'm guilty of that one. Yeah.
Yes.
But to not feel guilty about it, for sure.
Right.
Take a
'Cause
nap, you want to take a nap.
Right, it's okay to take a nap.
Yeah.
I know, I think people get confused or worried that, I'm being selfish and I'm putting
Mhm.
myself first, and making that's an okay thing to do.
Right.
Yeah, and I don't know how to emphasize that, especially I think for women or your
Mhm.
caretakers,
Mhm.
just those different capacities of, I got to take care of everybody else, but
Mhm.
kind of think of when you're riding on,
Mhm.
flying in the airplane, when they do the standard thing and you have to put the mask on yourself first so that you can take care of others around you.
Travis Jacobs he's done a lot of stuff for NAMI. He's an author. He does a lot of poetry writing,
Mhm.
especially around grief. He has this exercise that he does that I really love. He has you take 45 seconds and just write down things that pop in your head that bring you joy and make you feel happy, and then use that list as your list for self-care.
Mhm.
Because
Mhm.
everybody has something
Mhm.
different. I mean, I like to run when I'm stressed out, where somebody would be, oh, heck
Right.
no.
Nope,
Yeah.
That would make
That would stress me out.
That would
Yeah,
make me
that's
more
right.
stressed. Take that out.
But
Yeah,
somebody
that's right.
else might like, playing with the grandkids or gardening, or, gardening would not make me feel okay. But, if you do that, you have that list ready to go there, and, those things bring you joy, and it's unique to you.
Mhm.
So, that would be a good exercise or good way to, figure out, well, what does make me feel less stressed?
Mhm.
Because that's something I think we need to consciously think
Mhm.
about too, because we get so busy doing other things, we don't think about, well, how can I take care of myself,
Mhm.
and what does make me feel better?
I know, like, based off that, I tell people to start small. Then,
Mhm.
if you feel like you're being selfish, take, 15 minutes. Do something that brings you joy for 15 minutes, and start doing that routinely. And then you can build that up if if you're starting to feel selfish about it, and maybe just start small, and then it becomes, part of your schedule, part of your routine.
A
and
habit.
then it'll just be a habit, and people won't even think twice about it.
Absolutely.
Kelli, I want to say, one other thing I want to point out is I think a lot of people don't realize is how important nutrition is
Mhm.
to their body and their brain too. That's my other soapbox I get on, is that we need to remember to take care of
Mhm.
our bodies from the inside out too. We forget about that a lot of times, and that has a huge effect on your
It
mental
does.
health
Right.
Yeah.
and how you feel. Even something as simple as drinking enough water
Right.
during the day. Eating healthy, as healthy as you can, starting small
Mhm.
and doing that can make a big difference
Mhm.
in how you feel mentally too.
I can't remember where I saw it, but I was doing some research for a presentation, and I found that 95% of your serotonin actually comes from your GI tract. So
That's your second brain.
yeah,
Mhm.
so
I always say follow your gut.
Yeah,
right.
So.
The more we learn about our bodies and our brains and
Mhm.
everything, it's all very much connected,
Mhm.
and what we put in our bodies is very much connected too. So.
Yeah, so similarly, people might think they want to use a substance, particularly in excess, to help them alleviate stress, and that's never something we would advise. It is a substance that causes impairment in your functioning and your judgment, and it's also got residual rebound effect of it might make you feel euphoric for a while, but then the residual fact is that it actually is a depressant, and that will set in. So we want to caution people if that's what they think their go-to coping skill might be.
Right, yeah, and I think too, you bring up a very good point, especially now with social media and things like that, you see all these memes and jokes about, wine 30 and mommy needs a drink and, all of that, where, for most people, they can kind of laugh and pass through, skim over those things, but for some, I mean, that is a coping mechanism that we see a lot, and I think it's one that people don't like to talk about because it's too personal for themselves, but it's something that we need to be more aware of and sensitive about it. Like someone's having a bad day, or hey, let's go for a drink, or let's go do this, and trying to think of maybe some of those alternatives, because we don't know how it's going to impact our thinking down the road, or the impulse or the decision making. So definitely. Just going to look here quick to see if we're covering. This has been great conversation. I always learn so much from you guys when we have these conversations. But I think just to kind of start wrapping things up a little bit, just to kind of to hit on again, what are the different types of resources and services available in our community, and how can our community members reach out or find those resources?
Well, at the Human Service Agency, we provide a wide range of services for drug and alcohol, mental health, psychiatric, prevention resources. That could be accessed just by calling 886-0123, and then asking the receptionist will walk you through. If you talk about what you need, they will walk you through what you need to know, or how you could get linked up. There's other private practitioners in the community too. Bridgeway, Dr. Bontrager, LSS, they all provide counseling services. We have a good working relationship with all of them. Sorry if I didn't mention all of them. And talking with your physician is always a great place to start too. If you go in for, if you went in for a COVID check, or maybe went in for a pneumonia, and you start talking about, they have you do a depression anxiety screen almost every time. And if that indicates that you're kind of struggling or you wanted some assistance, they're all great about lining you up with HSA in any way or another private provider if that's what you need. So we just want to know that, we want people to know, or at least I want people to know for sure, that resources are out there and available to anyone who's not doing well or feel like they need a hand up. So just make those phone calls and we'll get you, set up with someone that can help you.
And I want people to know not to give up. If you maybe went to a counselor wherever and you didn't have a good experience, or you didn't connect with that person, keep trying until you find someone that you connect with, because it might take a couple times.
Absolutely.
Before you find someone to connect with. And counselors know that. They're not going to get offended if you say, I'm not connecting. Do you know someone else I can talk to? That's fine. You need to do that, and that's okay to do that. So just keep trying to find someone that you connect with and feel comfortable with, and don't give up. You have to be an advocate for yourself. If you have a child, you have to be an advocate for your child too, to make sure that they get the help that they need, with doctors, with counselors, with the school, with everyone.
And what about what we're doing here in Watertown?
well, I guess before that, if you don't know where to go, you can always call the police department. I can help connect you with whatever kind of service you might need, or even if you just don't know and you wanted to see what resources there are in town, I can help out with that. But for what we're doing, I guess, in Watertown, on Friday we are doing a Go Green Day, where we're all going to wear green, or everybody's going to try and wear green to support the Mental Health Awareness Month. Green's the color for that, so that's why we chose that color, and we're all going to either wear green or wear some ribbons for that.
That's
to show our
awesome.
support.
It is, and I think that helps. It brings the community together to understand and maybe to ask some different questions or to seek those services that maybe they haven't in the past. So I'd like to thank you guys today for coming and visiting with me a little bit more and educating people on mental health and mental health conditions. Any final words as we wrap up today?
I just want everyone to know, like we said earlier, that if you needed help in any regard, whether it was you're just kind of feeling stressed out, maybe depressed, having panic attacks, drinking too much, pick up the phone and call us. You are one phone call away from coming in and having us help you get to the place that you want to be. So thank you.
Ditto.
Agreed.
Well, awesome.
All right. Thank you guys.
You bet. Thank you, Kelly.
Thank you.